2018 has been a year of medical breakthroughs.
So here to talk about some of them and the ones that have had the greatest impact is Dr. Sabrina Fabi. You are kind of always on the cutting edge of things that are happening. Let's start first with drones. We all love drones. We have the Fox 5 drone. Tell me what it's doing with medical stuff.
Yeah, so the FAA just recently approved 10 drones to be able to finally transport things like blood, even medications, to perhaps areas that don't have access to good medical care. And so this is great because it could potentially save lives if someone gets in a traumatic car accident and has lost a lot of blood and they don't have their specific blood type to get to them. So you may have to get it from a specific area. So there's one company in San Francisco called Zipline that recently had their drone approved that is able to do this. So I think that's wonderful. Another one in Reno, Nevada, which is actually transporting defibrillators. So if you have some type of incident where you need a defibrillator and there's not one on site, they can drone it to you.
How fast can they go?
That's a great question. I don't know, but hopefully fast enough, because you're right. If you don't address these things rapidly, there's no hope. But I think the future for this is potentially with organs.
That's what I was going to ask. Are they doing organs?
They're not doing organs right now, but I think that's where the future is, because you have to get these to very remote places sometimes that is just really virtually impossible.
It's amazing how drones have changed so much with delivery of products or the discussion of it or fighting fires or whatever the case may be, including obviously medical. Let's talk about medical contact lenses and what they can do for the eye.
That's brilliant. So this was something that was developed at Boston Children's Hospital in collaboration with the Massachusetts Eye and Ear Infirmary, where they have now come up with a contact lens that delivers medicine slowly over months even to treat conditions like glaucoma or conditions like diabetic retinopathy, which is a condition that affects your retina from having diabetes. These are patients that are constantly having to use drops, sometimes aren't compliant with their medications, and ultimately can lose their sight as a result. And so if you have a contact lens that's constantly delivering the medication for you, then you don't have to worry. And so
it's got to come in small doses though, right?
Right.
If you're wearing them all the time, I would
guess. Yes, nano doses. And so what this means, I'm always kind of more interested in what it means for the future. So could you imagine this for little kids or people that have real serious medical conditions and don't want to swallow a pill? And so here now you have a lens that will consistently make you compliant with your medication.
Wow, that is really cool. All right, let's talk about preventing hair loss in chemo. We do a lot of stories with chemo patients. The hair loss is a big one.
It's so distressing because sometimes you can deal with, it's hard enough to deal with cancer, but when you see the outward effect of what it's having on you and you're losing your hair, this is something that has a great impact on the psychosocial well-being of many people. And so these are these helmets essentially that decrease the topical surface area of your scalp to about 25 degrees Fahrenheit. And so it causes a constriction of all your little blood vessels so that the chemo agent can't get to the blood supply of the hair follicle. And so this is brilliant. It was originally approved back in 2015 for the use with breast cancer, but now they're even using it for more solid tumors. So this is wonderful, and this could really help patients that go through that, because then it takes a while for that hair to grow back, even once the cancer is cured. So this is really promising.
You wonder if too they could use that same idea of cooling parts of your body where you don't want the chemo, your arms, things, parts of your face, to keep your hair on your eyelashes, things like that. Really interesting.
Exactly.
Dr. Fabi, always great to have you around the table. Thanks.
Thanks for having me.